What if your next fall isn't random at all, but the perfect storm waiting to happen? Picture this. A pair of worn-out slippers with no grip, a dark hallway with one bulb burned out, and a tiny inner ear problem you didn't even know you had. Separately, they seem harmless. Together, they're a recipe for disaster. Doctors warn that almost 99% of women over 60 are walking around with these hidden traps every single day. A slip here, a stumble there, and suddenly independence is gone. The shocking truth. Nearly all of it comes down to 6 mistakes. Common preventable errors that steal balance step by step. Today, we're ranking those 6 mistakes from the least to the most devastating. So, you'll know exactly what's waiting to trip you up before it's too late. All the references and studies I'm using are linked in the description because you should never take anyone's word without checking the science yourself. Before we dive in, let me ask you, how old are you? And what's the trickiest place in your home to walk safely? Stairs, bathroom, or hallway? Drop your answer in the comments. I read them like a safety map of this community, and I respond because your story might help protect another woman watching right now. Now, without any further ado, let's start with number 6 on the list. And it begins with a mistake most women make just after they leave the bedroom in the morning. Number 6. Wearing slippery shoes or old footwear. It may sound simple, but shoes can determine whether you stay balanced or end up falling. Many older women underestimate just how much their footwear affects their stability. Slippery soles, worn-out heels, or shoes that have lost traction quietly turn each step into a risk. When you're younger, your muscles and reflexes can catch you if you slip. But after 60, weaker leg strength and slower reaction times mean that a single misstep on a slick tile or uneven surface can lead to a serious fall. Research supports what many seniors realize too late. A study published in the Journal of the American Geriatric Society found that women over 65 who wore worn or unstable footwear had a 55% greater risk of falling compared to those wearing supportive shoes. Shoes that are too loose, too soft, or too rigid can all contribute. Instead of offering stability, they cause small shifts in balance with every step. These are shifts a younger body might correct quickly, but an older body finds harder to manage. Consider Helen, 74, from Michigan. She loved her old slippers. They were soft, comfortable, and easy to wear. But one rainy morning, as she stepped onto her porch, the worn-out soles failed her. Helen fell hard and broke her wrist. Later, her doctor explained that her shoes were just as responsible as the slippery surface. She admitted she had ignored her daughter's advice to replace them because she believed shoes are just shoes. That fall changed her outlook completely. What happens inside the body makes this even more risky. With aging, proprioception, the body's sense of position, naturally declines. When combined with shoes that slide instead of grip, it's like walking without clear awareness of your footing. Every step becomes less about moving forward and more about staying upright. Since balance relies on the small muscles in the feet and ankles, old or unstable footwear forces them to work harder, tiring them faster and increasing the chance of a fall. The solution is simpler than many think, but it requires taking action. Supportive shoes with non-slip soles, low heels, and firm cushioning can immediately reduce fall risk by giving the body a stable base. Think of shoes as your second set of bones. If they are weak, they cannot support you. Replace footwear once the tread wears down, and avoid backless slippers or smooth leather soles that can slide on tile or wood. Even indoors, wearing stable shoes instead of going barefoot or just wearing socks can significantly lower the risk of falling. For older women, shoes are not just about style or comfort. They are essential for safety. Ignoring them is like not wearing a seatbelt in traffic. You may be fine for now, but the risk remains. And if footwear alone can create this much danger, the next mistake is even more surprising because it comes not from what you wear, but from what you fail to drink every morning, quietly affecting your balance from within. Number 5. Not drinking enough water. One of the most commonly overlooked causes of balance problems in older women isn't anything unusual. It's simply not drinking enough water. Dehydration doesn't always appear obvious. For many seniors, it develops quietly, first showing up as dizziness when standing, lightheadedness during short walks, or a sudden sense of weakness that makes the legs feel unsteady. For women over 60, These small warning signs can quickly lead to serious falls. From a physiological perspective, the aging body loses sensitivity to thirst. This means that by the time an older woman feels thirsty, her body is already low on fluids. Dehydration thickens the blood, which reduces circulation to the brain and muscles, and it disrupts electrolyte balance, especially sodium and potassium, which are vital for nerve signals that keep muscles working properly. A study published in the Journal of Gerontology found that even mild dehydration raised the risk of falls in older adults by nearly 50%, mainly due to slower reaction times and poor balance control. Consider Marlene, 76, from Arizona. She believed her morning coffee and a small glass of juice provided enough fluids for the day. However, during the summer, she often felt dizzy when standing and once collapsed in her kitchen, breaking her shoulder. At the hospital, doctors found she was severely dehydrated. After her recovery, Marlene started carrying a refillable water bottle with her everywhere and made it a habit to drink small amounts throughout the day. Within a few weeks, she noticed her balance improving. Her headaches disappeared, and her energy came back. She now refers to hydration as her invisible support, something that quietly helps keep her steady. Dehydration also makes muscle cramps worse, which is a common issue among older women. Without enough fluids and electrolytes, muscles can tighten unexpectedly, making it more difficult to walk steadily or climb stairs without sudden discomfort. In addition, medications often prescribed to seniors, such as diuretics for blood pressure, can increase fluid loss, further raising the risk of imbalance. The solution is not complicated, but it does require consistency. Drinking small amounts of water regularly throughout the day is much more effective than consuming large amounts all at once. Including water-rich foods like cucumbers, watermelon, or soups can also help. Herbal teas without caffeine can count toward daily fluid intake as well. For most seniors, aiming for 6 to 8 cups of fluids daily, adjusted based on activity level and climate, can significantly improve balance and stability. Not drinking enough water may not seem like a major issue, but in reality, it disrupts the body's entire control system, including muscles, nerves, and circulation, making falls more likely. And if dehydration can affect balance this quickly, the next mistake is even more concerning because it's not about something you're lacking, but something you're taking every day that interferes with your stability. Before we move on, secure your place by liking and subscribing. The important health insight you need is coming right up next. Number 4. Taking multiple medications at once. Doctors refer to it as polypharmacy, but for many older women, it simply means taking several pills at the same time. Blood pressure medications, diabetes treatments, cholesterol drugs, and perhaps something for sleep or anxiety. Each one may be necessary on its own, but when combined, the risks can increase in ways most patients are never fully told about. Balance is often one of the first things affected. Research published in the Journal of the American Geriatric Society found that older adults taking 5 or more medications daily had nearly double the risk of falling compared to those taking fewer. The reason is straightforward. Many medications have side effects such as dizziness, drowsiness, or sudden drops in blood pressure. When these are combined, the body has a harder time maintaining stability. Along with age-related changes like slower metabolism, reduced body water, and weaker muscles, the effects of these medications become stronger and last longer. What may feel like simple fatigue could actually be a loss of balance. Consider Patricia, 73. She was taking 6 different prescriptions and began noticing she couldn't stand up without holding on to something. Her daughter assumed it was just aging, but her doctor later discovered that the combination of medications was lowering her blood pressure too quickly, causing her to feel lightheaded. After a careful review, some dosages were adjusted, and Patricia's balance improved almost right away. This highlights the hidden risk. Not just the medications themselves, but how they interact with each other. Blood pressure drugs combined with sleep aids or pain medications taken alongside antidepressants can increase instability. Many seniors blame themselves for being unsteady, when in reality their bodies are dealing with the effects of multiple medications. The solution is not to stop taking needed prescriptions, but to review them regularly with a doctor or pharmacist. In some cases, one medication can be reduced or removed, or the timing can be adjusted to avoid overlap. Even a small change can make a significant difference between walking confidently and experiencing a fall. If medications can disrupt balance this much, the next mistake is even more unexpected. Number 3. Skipping strength exercises. When many older women think about staying active, the first thing that comes to mind is walking. While walking is beneficial, it is not enough to protect against one of the biggest causes of balance problems, weak muscles. After the age of 60, women lose muscle at nearly twice the rate of men, especially in the hips, thighs, and core. This condition, known as sarcopenia, is one of the most overlooked reasons for poor balance. Without strength training to counter it, each step becomes less stable and every stumble more risky. A major study published in the Journal of Gerontology showed that women who did not take part in resistance training lost up to 30% of their leg strength by their 70s, while those who performed even light strength exercises maintained much of their stability. The difference was not only in muscle size, but also in confidence. Stronger women walked faster, stood more upright, and were able to recover more quickly if they tripped. In contrast, weakness meant that uneven surfaces or slippery floors became serious hazards. Consider Helen, 68. She believed that daily walking was enough until she tripped on a curb and was unable to catch herself. Her physical therapist explained that her legs did not have the strength to react quickly. When she began training twice a week using light dumbbells and chair squats, she noticed a significant change. Within 3 months, she could climb stairs without holding onto the railing, and her fear of falling decreased. She said, "I didn't just become stronger. I became more stable." The science is clear. Muscles are not only for movement. They also act as shock absorbers. They stabilize joints, support bones, and function as the body's safety system. Without them, the inner ear and vision have to work harder to keep balance, and eventually, the system can fail. The solution does not require intense workouts. Simple exercises like wall push-ups, sit-to-stand movements, or lifting light weights can build enough strength to reduce the risk of falling by half. For older women, avoiding strength training is like not wearing a seatbelt. It may not seem important at first, but the risk increases over time. And if not exercising can take away your balance, the next mistake is even more misleading because it often exists right inside your home. Number 2, poor lighting at home. You might think balance depends only on muscles, bones, or the inner ear. But vision plays a much bigger role than most seniors realize. The brain relies on the eyes to judge distance, detect obstacles, and guide every step. That is why poor lighting inside the home is one of the most underestimated balance mistakes older women make, and also one of the most dangerous. Research from the Journal of Environmental Health found that seniors living in dimly lit homes were 3 times more likely to experience falls, especially during the night. The reason is simple. As people age, the pupils become smaller and the lenses in the eyes lose clarity. This means older women often need nearly twice as much light as younger individuals to see properly. Dark hallways, poorly lit staircases, or shadowy bathrooms can quickly become hazardous areas where a single misstep can lead to a fall. Consider Eleanor, 76. She valued her independence, but often walked around her home at night using only a small lamp in the corner. One evening, she tripped over a rug she could not see clearly and broke her wrist. After her family installed brighter LED lights and added nightlights along the hallway, Eleanor was surprised by how much safer she felt moving around at night. She said it felt like her home was no longer working against her. The risk of poor lighting is not only about what you can see, but also about how you move. When seniors cannot see clearly, they tend to slow down, misjudge distances, or shuffle their feet, all of which increase the likelihood of falling. Proper lighting, however, immediately improves confidence and coordination. The solution is simple but can make a major difference. Replace dim bulbs with brighter ones. Install nightlights near bathrooms and along hallways, and ensure that staircases are well lit. These small adjustments can turn a home into a safer and more supportive environment. And while poor lighting can quietly increase the risk of falls, the number one mistake is even more serious because it does not come from the home or surroundings, but from within the body itself. Number 1, ignoring inner ear problems. The inner ear is small, but it functions as the body's control center for balance. Inside it, Fluid-filled canals and tiny hair cells continuously send signals to the brain about movement and position. When this system is disrupted, the effects can be severe: dizziness, vertigo, and sudden loss of balance. For older women, ignoring inner ear issues is the most dangerous mistake because it often leads directly to falls. Studies in the Journal of the American Academy of Audiology show that seniors with untreated vestibular disorders are up to 12 times more likely to experience serious falls. Common conditions such as benign paroxysmal positional vertigo, BPPV, where small crystals in the ear become displaced, or ongoing ear infections, often go undetected. Instead of seeking help, many women assume their dizziness is simply part of aging. But aging alone does not cause the sensation of the room spinning. That is usually linked to an inner ear issue. Consider Dolores, 71. She started feeling dizzy whenever she turned her head quickly, but dismissed it as something minor. Months later, she fell while stepping off a curb and fractured her hip. Only afterward did doctors diagnose BPPV, a condition that could have been treated with simple repositioning techniques for those tiny crystals. Dolores later told her friends, "I thought I was just clumsy. It turned out to be my ears." The unfortunate reality is that inner ear problems are often very treatable. Physical therapy techniques, balance exercises, and sometimes medication can restore stability. But when ignored, the brain receives mixed signals, making every step uncertain. For older women, this can quickly lead to a loss of independence. The message is clear. Dizziness and balance issues are not just signs of aging. They are warning signals that should not be ignored. Addressing them early can prevent serious falls and help restore confidence in movement. So there you have it. The 6 mistakes doctors say explain why nearly 99% of older women struggle with balance. From avoiding strength exercises and wearing unsafe footwear to poor hydration, multiple medications, inadequate lighting at home, and the most serious of all, ignoring inner ear problems. These are not minor issues. They are hidden risks that can turn a simple stumble into months of recovery, hospital stays, or even a loss of independence. But here is the important part. None of these mistakes are unavoidable. Every single one can be corrected starting today. Choosing better shoes, drinking enough water, reviewing medications, improving lighting, or getting your ears checked. Each small action can protect you from a life-changing fall. Balance is not lost because of age alone. It is often the result of habits, and habits can be changed. You will find the scientific references for everything shared here in the description below, so you can review the information yourself instead of relying only on what you hear. Now, I would like to hear from you. Where are you watching from? And which of these 6 mistakes surprised you the most? Share your thoughts in the comments. I read every message and respond because your experience might help protect someone else. If you found this video helpful, press the like button, share it with someone you care about, and subscribe for more science-based advice to support your health after 60. Remember, falls do not have to define aging. With the right knowledge and simple changes, you can remain steady, independent, and strong for years ahead. If you have any questions or want to share your own experience, feel free to leave a comment below. We are always here to listen. Thank you for watching.